Hello everybody, welcome to the OHSU Parkinson Center Ask the Doc segment. My name is Diana Potts and I'm here with neurologist Dr. Pfeiffer, and we have a question for you. Our question is, what is the difference between the tremor that you see in Parkinson's disease and other sorts of tremors?
Okay. This is the way at least one neurologist, me, thinks about tremor. I kind of divide it into three types or categories of tremor, and we'll use hands for an example in going through. The first kind of tremor is present when the hands are at rest, but if a person starts moving, the tremor goes away. That's called a rest tremor, and we'll come back to that. Second kind of tremor isn't there when the hands are at rest, but if the person holds them up against gravity, then the tremor starts. If the person reaches for something, the tremor may continue, but it doesn't necessarily get much worse. That's called a postural tremor, and we'll come back to that. The third kind of tremor is not there when the hands are at rest, not there when you put the hands out in front of you, but if you reach for something, the closer you get to the target, the worse the tremor gets. That's called an intention tremor, and you'll see that with conditions that affect a part of the brain called the cerebellum. Multiple sclerosis would be an example of that, or a tumor of the cerebellum. Those are not conditions that we typically see in the movement disorder clinic. They're handled in other parts of the neurology clinic. But let's come back to the other two kinds of tremor, because that gets into this issue of how do you differentiate Parkinson's disease from essential or familial tremor. A postural tremor, like you see with essential tremor, seems pretty simple. It's there when you put your hands up against gravity. It's not quite so simple. There are other conditions that can cause a postural tremor. Actually, all of us have a little bit of tremor. That's called physiologic tremor. And if I put my hand up, you don't necessarily see anything, but if I do something like this, you can see that the paper shakes a bit. And for some people, the tremor becomes very exaggerated. That's called exaggerated physiologic tremor. Can be confused with essential tremor. Certain medicines can cause an abnormal postural tremor. Lithium would be an example of that, or Depakote or valproate. But the most common cause for this kind of tremor is actually essential or familial tremor. And people with essential or familial tremor may have tremor elsewhere. Their head may shake, or their voice may quiver. A perfect example of that was the famous actress Katharine Hepburn, but you have to be old enough to know who that was. The third kind of tremor, the rest tremor, is classic for Parkinson's disease. It's there when the hands are at rest, and of course people with Parkinson's disease have other features, the stiffness, the slowness, that help to differentiate. But what can be confusing is that with a person with Parkinson's disease may put their hands out, and after a pause, tremor may reappear or reemerge, and that can get confusing with the tremor of essential tremor. One other helpful differentiating point, at least some of the time, is that a tremor of Parkinson's disease is usually asymmetric. One side is affected first and more severely than the other, whereas the essential or familial tremor is usually both hands pretty symmetrically, although that's not always the case either. So defining or differentiating tremor can be a little bit difficult and tricky at times, but that's the basics. So thank you.
Well, thank you very much for all that information. And I want to remind everyone that any information you see, please don't take this as personal medical advice, and if you have any questions, please go see a specialist. And thank you again for joining us today with the OHSU Parkinson Center Ask the Doc.